Hello friends, today I am going to reveal some true facts of latest in medical science. But first of all, I request you to please share and subscribe my channel for getting my informative true facts videos uninterrupted. Please note that subscription of my channel is free of cost. Now new research in latest in medical science. Type 2 diabetes, blood pressure drugs may be harmful for some patients. For some patients with type 2 diabetes, treatment with intense blood lowering medication may be more harm than good. This is published in a recent journal. The researchers, including Mattis Bostrom of the Department of the Public Health and Clinical Medicine and Umeå University in Sweden, found that antihypertensive drugs may increase the risk of cardiovascular death for diabetes. Patients with systolic blood pressure under 140 mm per Hg, while almost 1 in 2 people in the US have high blood pressure or hypertension. The conditions affects around 2 in 3 Americans with diabetes, putting them at higher risk of stroke, heart disease and other cardiovascular problems. As such, people with diabetes are often prescribed medications to help lower blood pressure. The American Diabetes Association recommends a systolic blood pressure target of less than 140 mm per Hg for patients with type 2 diabetes. The most common form of diabetes, the target of less than 143 mm per Hg is recommended for some patients. It can be achieved safely. For this study, Bostrom and colleagues, Bob Karlberg, also of the Department of Public Health and Clinical Medicine at Umeå, set out to investigate whether the effects of antihypertensive medications vary depending on the patient's blood pressure prior to treatment. Increased cardiovascular death risk for some diabetes patients. The team conducted a meta-analysis of 49 randomized controlled trials involving a total of 73,738 participants that looked at the cardiovascular outcome of people with diabetes who were receiving blood pressures lowering medication. The vast majority of participants had type 2 diabetes, and subjects were followed up by at least 12 months. The team looked at the blood pressure of participants before treatment and assessed the cardiovascular effects of antihypertensive medication. The researchers found that participants whose blood pressure was higher than 140 mm per Hg before treatment had a reduced risk of stroke, heart attack, heart failure and all-cause mortality. Among subjects whose blood pressure was less than 140 mm per Hg prior to antihypertensive treatment, however, no cardiovascular benefits were identified. In fact, these participants were found to be at a great risk of cardiovascular death. Commenting on the findings, Bostrom says, our study shows that intensive blood pressure lowering treatment using antihypertensive drugs may be harmful for people with diabetes and systolic blood pressure less than 140 mm per Hg. The researchers stress that because most participants had type 2 diabetes, the result may be applied to people with type 1 diabetes also, or those with diabetes who have normal blood pressure. Additionally, they point out that the antihypertensive medication is crucial to most people with diabetes who have a systolic blood pressure above 140 mm per Hg. In practice, it is important to remember that treatment of high blood pressure is a bigger problem than over-treatment at Bostrom. Still, the team says that the findings could have important implications for clinical guidelines for diabetes patients with high blood pressure, noting that many countries are due to review such guidelines in the next few years. It has been discussed to recommend even lower blood pressure levels for people with diabetes, maybe as low as 130, say Bostrom. We are hoping that our study, which shows potential risk of such aggressive blood pressures lowering treatment will come to influence these guidelines. In my next video, I will reveal some true facts of latest in medical science research. Thanks.